Hi, in this video we'd like to talk about how HPV actually causes cancer in infected individuals. Now in our previous videos we repeatedly talked about low risk HPVs are actually more common. High risk HPVs, although they are less common, but they can lead to potential fatal cancers in infected individuals, and they are mainly transmitted through sexual intercourse via vaginal, oral and anal cancers. So because of these three main routes, you will see that these cancers actually form within these regions. For example, cancers of the cervix, which is the most common one, and then cancers of the vulvar, vaginal, and then oropharynx, and in men, there's also the cancers of the penial and also anal regions. These are very common and getting more and more common nowadays. So we will need to emphasize early screening, prevention, and then our Antai Hospitals highly effective patented treatment that can actually stop this progression of cancer development. So how does HPV actually lead to cancer? We need to understand why it actually happens. So high risk HPVs, there are only about 20 to 30 that we know of, but every day there are new strands that are being discovered on the daily basis, because the entire family is up to 200 different HPV strains that we only know of. There could be potentially more than that. And these high-risk HPV strains, they carry viral oncogenes. So viral oncogenes means these proteins can actually cause cancer. And specifically, they are known as E6 and E7. So each of these cancer-causing HPV, they carry E6 and E7. And once they infiltrate an infected cell, so they enter into the cell of your cervix, of your anal regions, wherever that it may potentially have first contact, then they will actually target very specifically certain components of the cell. So in your cell, every healthy individual cell, there is a component known as P53 and PRB. So these two are protein genes that have very important functions that control the life of the cell. So P53 has the very important function of programmed cell death and also immune system recognition. With P53, the cell has a lifespan. When it has been damaged, it will actually induce cell death so that it doesn't spread. Furthermore, it also allows the immune system to recognize when it's damaged so that immune cells can come and remove it. So very coincidentally, E6 degrades P53, which means it kills P53 or removes it, degrades it so that there is no P53. It loses the ability to get recognized by the immune system and also loses the ability for controlled cell death. So this causes a damaged cell to constantly multiply without any supervision by P53. Next up, PRB is another protein that actually controls the cellular division of the cell. So the cell cycle is controlled by PRB, and E7 degrades PRB, causing the cell to multiply constantly and uncontrollably. This is how the cell starts to multiply, and then the viral load of the HPV initially is increasing. This is how cancer begins to form. At this stage, early screening and treatment is still effective. That's why in Antai Hospital we always recommend you to screen, get diagnosed, and always have HPV vaccination. Now, even though you have been diagnosed with these types of cancers, in the early stage, especially precancerous stage, CIN1, CIN2, CIN3, we can actually still effectively treat your cancer, stop it from progressing into full carcinoma, where that is much more difficult to control now. Now, in Antai Hospital, you don't need to trust in our words, trust in our actions. Now, if you receive our treatment, within 3 to 6 months, you can actually fully recover from these kinds of infections and stop the onset progression of cancer. Now, a lot of times, our patients are asking, is the treatment painful? How is it being administered? This treatment does not involve any surgeries. There is no pain involved. In fact, it will give you a sense of relief, because usually these precancerous regions, affected regions, wherever they may be, usually they're itchy or they may carry some slight pain. So the moment that we apply our medication on these affected regions, the patient has an immediate sense of relief. The itching stops, the pain also stops. So these are some things that we can provide to you, and within 3 to 6 months, we will sign a contract with our patients. You will recover within this period. Otherwise, we will refund you the full treatment cost. Provide treatment for patients who are infected with HPV and seeking treatment as long as you are before cancerous stage, regardless of what kind of high-risk HPV infection you may have. So we can offer you a full refund guarantee, money-back guarantee for effective treatment results. Get in touch with us today if you'd like to receive this treatment, receive an online consultation regarding your HPV infection, and see how we can actually help you today. Leave me a comment down below as well.